Movement. Now for the movements part, the hip joint of each leg should be assessed and compared. If the patient's problem is on a particular leg, the doctor assesses the normal leg first for comparison. For the active movements, the doctor should clearly explain and demonstrate each movement they expect the patient to perform. And as the patient performs them, they note any restrictions in the range of the joint's movement and also looks for signs of discomfort. Active hip flexion. Ask the patient to flex their hip as far as they are able. You could say, bring your knee as close to your chest as you can. Place your hand under the lumbar spine to detect masking of restricted hip joint movement by the pelvis and the lumbar spine. Active hip extension. Next, ask the patient to extend their leg so that it is flat on the bed. The leg should be able to lie completely flat. Now we move on to the passive movements, where the doctor asks the patient to relax, allowing them to move the joints freely and assess the full range of joint movement. It's important for the doctor to feel for crepitus as they move the joint, which can be associated with osteoarthritis, and observe any discomfort or restriction in the joint's range of movement. Passive hip flexion. While supporting the patient's leg, flex the hip as far as you are able, making sure to observe for signs of discomfort. Passive hip internal rotation. Flex the patient's hip and knee joint to 90 degrees and then rotate their foot laterally. The earliest finding in hip disease is usually restriction of internal rotation. Passive hip external rotation. Flex the patient's hip and knee joint to 90 degrees and then rotate their foot medially. Passive hip abduction. With the patient's legs straight and flat on the bed, use one of your hands to hold the ankle of the hip being assessed and place your other hand over the contralateral iliac crest to stabilize the pelvis. Move the patient's ankle laterally to abduct the hip until the pelvis begins to tilt. Passive hip adduction. With the patient's legs straight and flat on the bed, use one of your hands to hold the ankle of the hip being assessed and place your other hand over the contralateral iliac crest to stabilize the pelvis. Then move the patient's ankle medially to adduct the hip until the pelvis begins to tilt. Passive hip extension. Now ask the patient to lie in a prone position, lying on their belly. Use one hand to hold the ankle of the leg being assessed and place the other hand on the ipsilateral pelvis. Lift the leg to extend the hip joint and assess the range of hip joint extension.